to the 9th annual CR Arthritis event. I absolutely had to chase down Dr. Carson Leung and ask him for an interview on a really, really exciting and really very much so innovative project that we're going to talk about today. And with that, Dr. Leung is a full professor at the University of Manitoba, as well as the founder and director of the Database and Data Mining Lab as part of the Faculty for Computer Science. And with that, he also led a workshop at the CRA-AHPA annual scientific meeting titled Artificial Intelligence in Practice, Pattern Mining of Data Care Data for Complex Chronic Conditions. A little bit of a mouthful, don't worry. We are going to unravel that just a bit. And with that, thank you so much, Dr. Leung, for joining us today.
Oh, thank you.
Dr. Leung, can you tell us a little bit about yourself, maybe how you came to your interest in data mining and how that is now transferred to research in rheumatology?
Okay, so as you mentioned this, well, I'm a full professor here in the Department of Computer Science at the University of Manitoba, and I'm also the chair of the data science program here in the Faculty of Science at the University of Manitoba, and also the editor-in-chief of the journals called the Advanced in Data Science and Adaptive Data Analysis. So I got my PhD in computer science at the University of British Columbia, UBC in Vancouver. As you mentioned this, I'm in the founders of and the director of the database and data mining lab. So my research interest is in the areas of big data science, data management, data mining, as well as the data visualizations. And as such, I have the privilege to actually work with different peoples on analyzing this wide varieties of data, and that include, for example, we are talking about the shopper markets data, in which we analyze the transactions of the shoppers, and then what kind of merchandise items they purchase, and then find some frequently occurring items collections of items that frequently purchased by the customers. We also have analyzing something like this, the transportation data, looking at the public transit data, and then to see where the demand for the rider is there in a particular route and a particular times of the day, and in which the bus are on times or the bus are late and things like that. So that would actually help to actually to improve our daily life. And then at the same time, we also have analyzing some other types of data, including data that in the more on the social network, social science side. For example, looking at the impacts of the COVID-19 on different industrial sector. Whereas in terms of the in the medical field, and then we look at various types of the healthcare data, and then to see how does it actually affect the peoples. And then, for example, in this project that we present in the annual scientific meetings when we're talking about the AI in practice. And then so in here, what we have is that I have the privileges to work with a rheumatologist and on this topics, and then analyzing some of the healthcare data, or more specifically the health administrative data related to the juvenile arthritis the patients, and then to actually find some common patterns from the data.
It's incredible, because it just sounds like you're able to, understand data, or, correct me if I'm wrong, my understanding of information from different fields. And when you say analyze, really, you mean you look for patterns so that you are able to understand, draw conclusions, predict the future. But your work in itself, and the set of skills that your lab has developed and is really honing and is really, pushing forward, can be transferred to any field. And in this case, we're lucky because now we have you in rheumatology, and you are looking at healthcare data or healthcare information. Can I ask, what specific data are you looking at? And what is this process of mining data?
Okay, so in general, Data mining is a process of actually this is a non-trivial discovery of implicit, previous unknown, and useful information from data. So as I mentioned this in some of the applications like this in the shopper market, this data examples, and we wanted to find this, okay, what are the merchandise items that are frequently purchased by the customers, and then reviews the connections among this, all those, this, well, maybe we can find this, the customer always purchase the meal and bread together, and then so that this, it can actually this help the both this, the shop owners as well as for the shoppers, for example, the knowing that there's, oh, customer always purchase the two items, these two items together. We just put it this, okay, close to each other for the convenience for the customer. So in here, in this example, in our cases related to the healthcare administrative data, so we are actually just looking at specifically there's some of the data like this, for example, from the hospital records as well as from the physician billing claim. And then so that will reviews some of the health conditions of the patients through this, the ICD code, the international classifications of disease code, then we can know this, okay, the health conditions of the patient. So in here, in particular, we are looking at this the data about the 386 juvenile arthritis patients. The data was collected back in the from the 1980s all the way to 2018, and then so this, and then for the patients, and then from those information, the data, those are anonymized data, so we don't know the identity of the patients, and then to find this, okay, some of the common patterns from that.
Incredible, like you said, right? It's a process of discovery, even though, you know, we think of discovery very differently in different fields, looking at the data to find new meaning or new patterns within data that may not be there when we just look at, okay, there's a bunch of numbers, there's a bunch of words, but what is truly there? And I think the example that you gave to us about, you know, looking at the store and looking at what they sell, and there are two items that sell seem to go out to be checked out at the same time, and then putting them together in the store. Like, I think that is a really great example for us to help understand what we can do with administrative data as well. Are there two things that always happen to be there, and maybe we need to take those two processes and make them a little bit more congruent with another and make that a little faster, right? Especially if it's administrative stuff. So I love that you are speeding up and better understanding those processes. So when we look at this administrative data, and correct me if I'm wrong, but you're aiming to look at behaviors leading to the diagnosis of rheumatic diseases. Can you tell us a little bit more about that? So how do we look at behaviors, and how could that help us in that?
Mm-hmm. Okay, so how we look at that is, so given that the administrative, the health administrative data that we have, and then so it captures by code about the health conditions of the patients, the diagnostic of the health conditions. So based on that, and we look at, okay, the sequences of event. So in my early example, when we are talking about this, the shop examples, we are only this, okay, knowing there's a lot of, say, customer purchased these two items together. But at the same time, we also done the co-occurrence of the event. But we also wanted to look at the sequence of events that's leading to the diagnostic of a certain disease. In this particular cases, we are talking about the juvenile arthritis. And then so that is what we want us to do, to have done this is that this, okay, look at those data, and then when we're talking about this, the JA patients, so it can be as young as, okay, say from the day of birth and all the way this up to the age of 16. And then the data that we obtain, given that this, we are talking about it from the 1980s all the way to the 2018, so spending over this about this 38 years time period. So in order to find this, okay, some interesting or common pattern from that, so we look at, okay, the day of the diagnostic, and then trace it back. This is, okay, prior to the day of diagnostic, okay, what are the sequence of the medical encounters say 6 months prior to that, 12 months prior to that, and then there's 18 months, 24 months, and so on, up to about this 16 years prior to the data diagnostic. And then from that, and then we wanted to and apply this design, and then the algorithm, computational this algorithms, and then to actually define this some pattern. So for example, this we at the end of the mining process, we were able to find about this, roughly about the 600 sequences that are. So among the 600 sequences, I can actually just give an examples of a few of them here. For example, we find that there it's very common for the patient to have the rheumatoid arthritis, followed by 2 encounters of the joint disorders. That all 3 encounters happened within the 6 months prior to the diagnostics of the disease. And then there's another pattern that we find is we are not confined to only the patterns that occur just the 6 months prior to the data diagnostic. The following example that I have is many patients actually that have 3 encounters of the upper respiratory infection that occurred from 6 to 12 months prior to diagnostic, and then after that, and then they have the joint disorder, and then within this the 6 months prior to the diagnostic, and then so that's another patterns. And then these 2 patterns is when you look at that, this is if you ask them many of the rheumatologists, and they will agree that yes, then these are actually some of the patterns that they're very familiar with that. But at the same time, so the good thing is, our algorithms were able to find the patterns in which the rheumatologist are actually familiar with. It is an indication that our algorithm does produce the results that make sense. And at the same time, our algorithm also defines some other patterns that may not necessarily be that familiar with by the rheumatologist. And then when we show them, yes, and they later on they find that yes, they agree that is actually a pattern, but probably not something that first in their mind. For example, that we find that there's so quite a number of patients also have the allergic reactions from 6 to 12 months prior to diagnostic, followed by a joint disorder within the 6 months prior to the diagnostic. So that is actually some of the patterns that which may not just be that obvious to the rheumatologist, but then our algorithms were able to find that information.
Yeah, I think the second one, so the 2 patterns that you'd pointed out, I'm sure you'll discover more as you mine deeper into the data. The second one about the upper respiratory tract infection prior to them receiving their diagnosis, I'm like, well, it kind of makes sense, because I know at that point the immune system is already compromised, but there must be other things going on that we don't yet understand. But because you're able to mine that data, now we can go and dig deeper. Why is it that X amount of people, X% of people, this pattern of, having a respiratory tract infection prior to diagnosis? So interesting. Wow. So really, it's an amazing way to ask more questions, better questions, right? Because it's not that you're answering a question, so to say. Data mining is a beautiful way to ask better questions. That's what I'm learning.
Yep.
Amazing. And with that, I know when you do work with data, and especially large data sets, and you're looking at patterns, can you tell us about how do you make sure that these patterns that you find are reliable and that they're valid? So what are kind of those techniques that you use to make sure that this is truly a pattern and this is actually reflected in the real world?
Okay, so to answer this question is, there are 2 aspects of that. From the computational side, our algorithms is a sequential mining that has been around for more than 2 decades. So we design our computational algorithm based on the concept of the sequential mining. So from that point of view, the algorithm that we design actually complete and correct in the sense that we do have the theoretical proof from the all those there's mathematical proof there's like you have seen, and then so from that side is on the computational side is okay, we were able to algorithm is able to find this all those this interesting patterns, and also all the patterns that are returned are actually there's correct, and then it's a correct summarizations of all those this patients the patients the data about those patients. So from that aspect is, and then also this that is correct, and also this the algorithm itself this can be applicable this in many others this different domains. So we have also to try this okay outside of the medical domain, so to ensure that our algorithm this is reliable as well as it is it gives this valid answer. So aside from the computational aspect, how about this from the medical side as well as this from the semantic aspect? Does these patterns, does it make sense? So we actually does okay have conducted some face validations, and then to check this by the rheumatologists that are in the projects, and then they ensure that this okay as I mentioned earlier, this the pattern that we find many of them is okay what they expect, and then there's also this quite well known to them, so which is good, meaning that this okay we were able to define the patterns is okay that would be the first thing is or the sequences what they have in their mind. At the same time, this we were able to discover something that may be less obvious or not just something that they come to their mind, but then they also did verify that this okay those make sense, and then which is good because this well in the sense that we find that something that is less obvious, and then but that is actually the useful. And then moreover, this also delighted to point out this okay so far what we have this find here is we apply the sequential mining. Basically this it would help us to find the common patterns that we can obtain from this set of data with 386 juvenile arthritis the patients with the data collectors back in the 80s to 2018. So it, in the sense that there's the sequential pattern that we find is actually this is a summary information. So we are not this okay, not yet this okay making a prediction for the future data. So from the accuracy point of view, it is a true 100% is okay summaries informations of what we have. Whereas the next step, what we wanted to do is to actually this okay to make some prediction.
Right. And that's beautiful. And you know, it is very rigorous, as we say in research, where not only do you have to build this algorithm, really this model, this equation for understanding, you then test in different fields, different areas, so that you're like, okay, it can hold up, right? It holds up. And then once you do have some results, or you think something may be a pattern, then you also bring it to rheumatologists, right? I know that you work as a part of a multidisciplinary team. You bring it to the experts, the clinicians, the individuals who are seeing the patients. You're like, does this feel right to you? Are you seeing this? Is aligned with your understanding? And they give you a yes or and then you then tweak, and then you refine, and then you make this model or this algorithm a little bit better. So really an incredibly rigorous process, and we're just extremely excited to see what you find and see what you're able to predict in future, Dr. Leung. With that, you know, do you have any last words for our audience? Anything to share? Anything they should be looking forward to?
Sure. So one thing that, as you mentioned, is well, here's this okay, we are using the AI to actually this okay to help the rheumatologist so that this will actually so that the computer can actually spend time doing the number crunchings, and then at the same time says the rheumatologist can actually end up spending more time on the patients, and also making the decisions. So we are not just saying this having this computer programs or having AI to replace the human. So it is not the case. We actually okay having the AI to help the rheumatologist, and then the end is the final decision that is made by the rheumatologist. And then as far as this project is concerned, then so as I mentioned, so far we are dealing with the finding the summary informations. Now, once we actually find all those common patterns, In terms of the future work, we would like this to actually base on the historical data, so that we can actually make the predictions or forecasts on them for the future data. And we also would like to apply it to some other data set. For example, currently we are using the data set from the patient in Manitoba, and we certainly would like to apply it to other provinces, so that patients in the other provinces or in other places can also be benefit from our programs. And then at the same time, while the algorithm is not necessarily just confined to dealing with the JA patients, and it can be also applied to others patients. For example, how about the adults, and how about the patients or some other related diseases, and that's the things we would like to apply to them.
I think you bring up such a great point, right? That there's a fear of AI is here to replace, but instead it's not that. It's here to relieve the mundane, not very necessary, but mundane tasks that a rheumatologist has on their plate, on top of being, there for their patients, so that they can be more present with their patients. They have longer time with their patients and less time documenting and searching and trying to understand things and going back and reading. That can be done by AI. So really it's a way to free up more time, more capacity to assist rheumatologists. And like you said, this technology hopefully will be able to help us in future to understand not only one rheumatic condition, but different rheumatic, different autoimmune, different inflammatory conditions as well. Thank you so much for all of your work in leading this field, Dr. Leung, and we are so grateful to have caught you and have the opportunity to understand your research. So with that, I do want to thank you for your time.
Oh, thanks for having me.
Absolutely. And to our audience, thank you so much for joining, and we hope that you check out the rest of our recordings. Take care and goodbye.